So we'll see today the most sought out MCQ, the most difficult MCQ, simple yet difficult MCQs. People tend to mess this MCQs up, and let's learn that Perio 2017 classification for once and for all. Because making a mistake in such a basic concept will cost you a lot. Okay, so now we'll see, because there have been MCQs wherein they have asked how the 2017 classification is different from 1999 diagnostic classification. Okay, so we'll go briefly about what are the differences between 2017 and 1999 classification. Okay, so here we are writing 2017 and here we are writing 1999. Okay, so here in each categories, the we have four categories here. Okay, and here we in 1999 classification we have eight categories. In four categories which are there, we have periodontal health, periodontal health, gingival diseases, gingival diseases, and conditions. Okay, under this part corresponds to gingival diseases in 1999. Okay, so this is the first category. Moving on to second category, we have periodontitis. As simple as that, periodontitis. Okay, now interestingly, what we can see here is as in 1999 what they did, we had chronic periodontitis, aggressive periodontitis, periodontitis as manifestation of systemic diseases. Sorry, I'm using a lot of acronyms. Then next one is necrotizing periodontal diseases. Okay, this is the second category. Now we look at the third category in 2017 classification, which is other conditions affecting the periodontium. So under this category we had, as in I'm telling you the counterparts. Okay, this is not what this includes, these are the counterparts where this is the earlier one and this is the new one. So here we have abscess of periodontium, periodontitis associated with endodontic lesions and lesions, and then developmental or acquired deformities. Okay, developmental or acquired deformities. Fine. And one of the new categories which 2017 introduced were peri-implant diseases and conditions. Okay, so let's recap what all we have seen. That is, first is your first category is periodontal health and gingival diseases, second is periodontitis, third is other conditions affecting periodontium, and peri-implant diseases and conditions. Okay, once this has been understood, I'll quickly also mention some more points about this difference. Is that major changes? Okay, major changes that we noticed are, first is that we already talked about, I think you can guess it, that peri-implant diseases and conditions were included. Okay, then another one which is that the one which is included is that it's defined periodontal health and gingivitis patient, which includes as in a patient with intact periodontium, reduced periodontium due to causes other than periodontitis, and reduced periodontium due to periodontitis. Okay, so this is something which was not there in 1999 classification. Then we also saw chronic and aggressive periodontitis terms have been removed. Okay, and what we have included is that here we have included molar incisor pattern of periodontitis. Okay, I think you understood up to this part. Then another as in this, if this MCQ comes, most of the times it comes as, you know, all are true regarding the 2017 classification except, or differences between 1999 classification and 2000 classification except. So that's why I'm trying to tell all the possible differences. Then current classification, as in which is the 2017 one, is more of evidence based and classifies recession based on predictability of recession coverage. Okay, whereas the earlier classification was, you know, more descriptive and involved assessment of defect relation to the mucogingival junction and radiographic assessment of the interdental bone. So these are certain 4 points that we need to know, the major changes between what changes happened from 1999 to 2017 classification. Okay, then we'll move on to the main problem, not more problem, the main classification. Now when we see the classification 2017 classification, what all things does it include? Okay, so the first category which I told, second, total 4 were, right? There were 4, right? Okay, so first, second, third and fourth. So first was periodontal health, gingival diseases and conditions. Second one was periodontitis. Third one was other conditions affecting periodontium, and the last one was peri-implant diseases and conditions. Okay, fine. So now under these headings we have subcategories. These are the major categories, and under this we have subcategories. So under first category we have periodontal and gingival health. Okay, under this we will be having intact periodontium or reduced periodontium. So what will come under reduced periodontium is already treated a patient, okay, already treated patient for some there was some gingival recession in that patient, and we have already treated that patient and there is some recession but the patient is healthy, okay, the mucosa and everything is healthy, so that becomes reduced periodontium. Just to know, make sure that you know this concept. Then second subcategory is gingivitis associated with biofilm. Okay, that is biofilm induced gingivitis. I want to do this. Under this we have a lot of categories, which is dental biofilm induced or systemic or local risk factors mediated, and we have here drug induced gingival enlargements. And the last one which we have is gingival diseases non-dental origin, okay, like genetic, inflammatory, immune, reactive, neoplasms, etc, etc. Oh, traumatic also will come here. Okay, traumatic. Now we'll have to see what is periodontitis, what all comes under periodontitis. Under periodontitis we have necrotizing ulcerative gingival disease, necrotizing periodontal diseases, which we have gingivitis, periodontitis and stomatitis. So now we have to know periodontitis, which is there. Periodontitis, it has staging 1 to 4 and extent which can be localized, generalized or molar incisor pattern, and then we have grading, which is A, B and C, okay. And the third subcategory is periodontitis as a manifestation, sorry I have a bad cough today while recording this, manifestation of systemic diseases. Alright, just highlight it for you. So this is a major category, okay. Periodontitis, other conditions, periodontal subheadings are these ones. Okay, then the next one that we have to see is under other conditions, which are systemic conditions. Systemic conditions affecting periodontal diseases. Other periodontal diseases such as abscess or endoperioral lesions. Here we have mucogingival deformities. What do you think? Can you guess what these are? Like gingival phenotype, then gingival recession, then we have decreased vestibular depth, aberrant frenum and gingival excess. And can you think something that we are missing, which is important to be evaluated when you're doing perioevaluation? Yes, which is traumatic occlusal forces. All right, So it will be primary, secondary orthophorsis, and then tooth and prosthesis related. Okay, so traumatic tooth and prosthesis related mucogingival defects, systemic conditions affecting periodontal and other periodontal diseases. And obviously here again we have, again obviously it's about the peri-implant, then it's about peri-implant health, peri-implant mucositis, peri-implantitis, and peri-implant hard, soft and hard tissues. Okay, peri-implant health, mucositis, peri-implantitis. So this is basically the 2017 classification which we have to see. Now I will tell you in detail about this one particular part. Okay, marketing of VAT. What is it? We'll be looking at this particular part, that is staging, how it is done, extent and grading. Okay, so when we look at periodontitis, is it right? Periodontitis, sorry, yes, now it is correct. Periodontitis, we have to know, okay, remember it as a sag. Okay, I think Gen Zs will know what sag is. What is it called? Okay, so it's sag. Now we have for S, you remember S is 1 to 4, extent is localize, generalize, molar incisor pattern, and G is ABC. So this is S is basically staging, extent and grading. Okay, now we'll move on to explaining this part. Okay, so under staging, this staging has again 3 parts. 1, 2, 3. Staging is done on basis of 3 parts, 1, 2 and 3. Remember RCT. Remember RCT. Okay, so R for wait, I told you ulta. I told you ulta, sorry. Remember SCE. Okay, remember SCE. And under severity, remember 3 things, which is RCT. My bad, sorry. Please check that again. So we have S, which is, guess what it is. Yes, it's the staging. Okay, it is S for staging. It has again 3 SCE. This S is for severe. Okay, severity. C for complexity, and E for okay, don't remember E. E is directly coming under extent. This becomes extent. Okay, so SCRCT. Remember, staging is done in the lawyer of Supreme Court who has RCT done. Okay, so remember this one particular thing. So I'll explain you how to evaluate severity. So when you're doing severity evaluation, remember RCT. R is for radiographic bone loss, then C is for clinical attachment loss, and tooth loss due to periodontitis. Okay, now here we need to know few things, because it was regarding staging, right? I'll use this color for the staging, this value is for extent. Okay, so all these things become staging. And staging, what did we see? Staging is 1, 2, 3 and 4. Okay, there are 4 stages. So under radiographic bone loss, what do we have? Tell me. Under radiographic bone loss, we will be having bone loss up to coronal 1/3. Stage 2 also it is. Okay, so both of this it is coronal 1/3. In stage 3 and stage 4 it becomes middle or apical 1/3. Now clinical attachment level, you have to know that one attachment loss 1 to 2 mm, 3 to 4 mm, and both of this is more than or equal to 5 mm clinical attachment loss. And here it is no tooth loss, but here we have stage 3 will be having more than 4 teeth lost, and stage 4 will have more than 5 teeth lost. Okay, so this is with respect to severity. Then what is remaining? Complexity. Now complexity is evaluated on based on probing depth and bone loss. Okay, here in stage 1 probing depth is less than 4 mm. In stage 2 it becomes less than or equal to 5 mm. See up, it's a probing depth, not clinical attachment loss. Then here we have probing depth more than or equal to 6 mm. Okay, and I'll explain the stage 4 later. Now here we have horizontal bone loss. Here we have again horizontal bone loss. Then here we have vertical bone loss more than or equal to 3 mm plus horizontal bone loss. And one more thing gets added here. Okay, one more thing gets added here, which is class 2 or class 3 furcation involvement and moderate ridge defects. Okay, I think this is you go through this section of the lecture again in order to understand. I'll again recap, but in stage 4 you have to know this is stage 3 plus. What other things are there is masticatory dysfunction, tooth mobility. Obviously everything is messed up here. Bite collapsed, pathologic migration, and less than 20 remaining teeth. Okay, so this is just of severity complexity. Okay, you remember here RCT, okay, SCRCT, complexity and everything. Does it done? Then we'll come to extent. Okay, localized, we'll take blue. It is localized, generalized molar incisor. Localized becomes less than 30%, generalized become more than equal to 30%, and molar incisor pattern, as you know. Now we'll look at the grading perspective. Okay, how do we grade? Okay, so now among grading whenever we are doing grading, so I'll use maybe, I think, like pink. Okay, purple it is. Okay, fine. So now we are moving on to grading. In grading, we have primary criteria and grade modifiers. Okay, so in grading, how we do is we have primary criteria and grade modifiers. Okay, primary criteria and grade modifiers. Now in primary criteria, how do we check is what is the progression that this is. Okay, and as in what I'm trying to say is direct progression and indirect progression signs. Okay, as an evidence, basically we're looking at the evidence of progression. These are the data which we have. Okay, then direct progression is given by radiographic bone loss or clinical attachment loss, and indirect can be given by percentage of bone loss according to the age and case phenotype. This is an interesting one. Okay, now once we know how the grading is done, right, we'll look at the grade modifiers later, but here so now we have grade A, grade B, grade C. Grade A is low rate, grade B is moderate as expected, and grade C is rapid rate. So what do you think radiographic bone loss or clinical attachment loss is the highest? Okay, so over 5 years, no loss. Over 5 years, less than 2 loss over period of 5 years, and more than equal to 2 loss over 5 years. Now percentage of bone loss, then when we see per according to the age, it is less than 0.25, 0.25 to 1, and more than 1. Okay, and case phenotype, here this is a very interesting point, because what we see is slow. Even if there are heavy biofilms, there will be low level of destruction. What do you think moderate will be? That destruction is almost equivalent to the amount of biofilm present, and here destruction is more than what we would expect according to the presence of biofilm. Okay, now grade modifiers which are there. This is I think when I was preparing and I had answered exam, this was one of the question which they had asked, what are the grade modifiers. Grade modifiers are basically the risk factors that we're looking into, and those are two. One is smoking and another one is diabetes. Grade 1, there is nothing, non-diabetic, non-smoker. Grade B is less than 10 cigs per day. Diabetic HbA1c is less than 7%, and here we have more than 10 cigs per day, and diabetic with HbA1c is more than equal to 7%. Okay, so this is the gist of the entire 2017 classification. Alright, please let me know if you have any doubts with respect to the same thing, and please do like, share and follow. Thank you.